Pregnancy is a time of joy, anticipation, and a whole lot of changes happening in a woman's body. It's a period where ensuring the health of both mother and baby is paramount. Amongst the many things expectant mothers learn about, gestational diabetes is a topic that deserves special attention. Gestational diabetes is a type of diabetes that develops during pregnancy. It affects how a woman's body uses sugar, a primary source of energy. During pregnancy, the body goes through hormonal changes that can sometimes interfere with insulin, a hormone that regulates blood sugar levels. When the body doesn't produce enough insulin or can't effectively use the insulin it makes, glucose builds up in the bloodstream, leading to high blood sugar. This is what characterizes gestational diabetes. While the diagnosis might seem overwhelming, it's crucial to remember that with proper management and care, women with gestational diabetes can have healthy pregnancies and deliver healthy babies. This guide will delve deeper into the causes, symptoms, risks, and management of gestational diabetes, empowering expectant mothers with the knowledge to make informed decisions about their health and the well-being of their little ones. To understand what causes gestational diabetes, we need to look at the role of insulin during pregnancy. Insulin is like a key that unlocks the doors of our body's cells, allowing glucose from the food we eat to enter and provide energy. During pregnancy, the placenta, which nourishes the baby, produces hormones that help the baby grow. However, these hormones also block the action of insulin in the mother's body. This phenomenon, known as insulin resistance, means that the mother's body needs to produce more insulin to keep blood sugar levels in check. For most pregnant women, the pancreas, the organ that produces insulin, can keep up with this increased demand. However, for some women, the pancreas can't quite make enough insulin, or the insulin produced isn't used effectively by the body. This leads to a buildup of glucose in the blood, resulting in gestational diabetes. While the exact reasons some women develop gestational diabetes while others don't are not fully understood, several factors can increase a woman's risk. These include family history of diabetes, being overweight or obese before pregnancy, age, women over 35 are at higher risk, and certain ethnic backgrounds. One of the tricky things about gestational diabetes is that it often doesn't present noticeable symptoms. Many women who develop it go about their pregnancies feeling perfectly fine, unaware of the changes in their blood sugar levels. This is why regular prenatal care and screenings are so crucial. However, some women may experience subtle signs, such as increased thirst, frequent urination, especially at night, unusual fatigue, blurred vision, frequent infections like urinary tract infections or yeast infections, and slow-healing sores or cuts. It's important to note that these symptoms can also be common during pregnancy, so they don't necessarily indicate gestational diabetes. If you experience any of these symptoms, it's essential to bring them to your healthcare provider's attention. They can perform a simple blood sugar test to determine if gestational diabetes is present. Early detection and management are key to ensuring a healthy pregnancy for both mother and baby. Gestational diabetes doesn't just affect the mother, it also has implications for the baby. High blood sugar levels in the mother can cross the placenta and affect the baby's growth and development. This can lead to a condition called macrosomia, where the baby grows larger than average. While a bigger baby might sound appealing, it can actually lead to complications during delivery, such as an increased risk of C-section shoulder dystocia, baby's shoulders getting stuck during delivery, and birth injuries. Babies born to mothers with gestational diabetes may also experience low blood sugar, hypoglycemia after birth, as they're used to receiving higher glucose levels in the womb. In the long term, children born to mothers with gestational diabetes may have an increased risk of developing obesity, type 2 diabetes, and other metabolic disorders later in life. For the mother, gestational diabetes increases the risk of developing type 2 diabetes after pregnancy. It's estimated that up to 50% of women with gestational diabetes develop type 2 diabetes within 5 to 10 years after delivery. Therefore, managing gestational diabetes is not just about ensuring a healthy pregnancy, it's also about reducing future health risks for both mother and child. Weighing the risks, who is most susceptible? While any woman can develop gestational diabetes during pregnancy, certain factors can significantly increase the risk. Understanding these risk factors can help women take proactive steps to manage their health and potentially prevent the condition. One of the most significant risk factors is family history. Women with a parent or sibling who has had gestational diabetes or type 2 diabetes are at a higher risk. Similarly, women who have had gestational diabetes in a previous pregnancy are more likely to develop it again in subsequent pregnancies. Being overweight or obese before pregnancy is another significant risk factor. Excess weight can contribute to insulin resistance, making it harder for the body to regulate blood sugar levels. Age also plays a role, with women over 35 being at increased risk. This is because insulin resistance tends to increase with age. Certain ethnic backgrounds, such as African American, Hispanic American, American Indian and Asian American women, are also at higher risk of developing gestational diabetes. Preventing gestational diabetes. While not all cases of gestational diabetes are preventable, there are steps women can take to lower their risk and promote a healthy pregnancy. One of the most effective ways to reduce the risk is by achieving and maintaining a healthy weight before conception. Losing even a small amount of weight, if you are overweight or obese, can significantly impact your chances of developing gestational diabetes. Adopting a healthy lifestyle that includes regular physical activity and a balanced diet rich in fruits, vegetables, whole grains and lean protein is crucial. Regular exercise helps improve insulin sensitivity, making it easier for the body to use insulin effectively. Aim for at least 30 minutes of moderate intensity exercise most days of the week. It's also essential to manage any existing health conditions such as prediabetes or polycystic ovary syndrome, as these can increase the risk of developing gestational diabetes. Sweet success. Managing gestational diabetes. If you've been diagnosed with gestational diabetes, don't panic. With proper management, you can still have a healthy pregnancy and a healthy baby. The primary goal of managing gestational diabetes is to keep your blood sugar levels within a target range set by your healthcare provider. This involves a combination of monitoring your blood sugar levels regularly, making healthy food choices, engaging in regular physical activity, and in some cases taking medication as prescribed. Your healthcare provider will work with you to create a personalized plan that meets your specific needs. Monitoring your blood sugar levels usually involves checking them several times a day using a blood glucose meter. This helps you understand how your body responds to different foods and activities. Your healthcare provider will guide you on the appropriate times to check your blood sugar and the target ranges to aim for. Research and real life. What studies tell us? Research on gestational diabetes has made significant strides in recent years, providing valuable insights into its causes, implications and management. Studies have shown that women who follow a Mediterranean-style diet during pregnancy, rich in fruits, vegetables, whole grains, legumes and healthy fats, have a lower risk of developing gestational diabetes. Regular exercise, particularly moderate-intensity aerobic exercise, has consistently been shown to improve insulin sensitivity and reduce the risk of gestational diabetes. In cases where lifestyle modifications alone are insufficient to manage blood sugar levels, insulin injections may be recommended. Insulin is a safe and effective treatment option during pregnancy, as it does not cross the placenta and therefore does not affect the baby. Studies have also highlighted the importance of early detection and management of gestational diabetes in reducing the risk of complications for both mother and child. Embracing a healthy tomorrow. Your journey to motherhood. The journey of pregnancy is unique and personal, filled with its own set of joys and challenges. Receiving a gestational diabetes diagnosis can feel overwhelming, but it's crucial to remember that you're not alone. With the right information, support and proactive approach, you can navigate this journey successfully and embrace the joys of motherhood. Remember, gestational diabetes is manageable, and by taking care of yourself, you're taking the best possible care of your little one. Lean on your healthcare team, educate yourself, and don't hesitate to seek support from loved ones. Embrace this chapter with strength and positivity, knowing that you've got this.